Ladies and gentlemen, you have the world's leading experts on school feeding on this panel. Use the opportunity to press them for more. The world is about to spend lots more billions on smart school nutrition, feeding, food for education, conditional, unconditionally, etc., transferred types of programs. It seems to me there's really a great progress in the understanding of not if to do school-related nutrition and food programs, but how to do them and how not to do them. I think it was great what we learned from the three of you.
My name is Rafael Merchan. I work for the Fabretto Children's Foundation. We run a school feeding program in Nicaragua in the north. My question has to do with the donor interested in the program in light of your new research. It seems, at least from the USA programs, Food for Peace and Food for Education at USDA, that they're reducing the amount of priority countries. I wanted to know if there is a global trend in which donors are going away from these programs, or is actually the opposite.
My question was about the younger siblings. The younger siblings are really, they seem to have a good explanation in Uganda if actually the children were going to school, and you seem to say that this is the explanation. It's a very large effect. I mean, almost 0.4 Z-score is a large effect on height, and it's certainly the first time that anybody demonstrates that kind of effect from a program that's not even targeted to the young children. So it's exciting, but it is also intriguing. And so my question is about Burkina Faso. Did you have the same magnitude of effect, and was it also a possibility that the children were just going to the school? That's unusual, and so we can't expect a sibling effect of that size in another environment where the younger siblings will not be able to go to school. So I'd like to know more about the Burkina Faso case.
I'm Giuseppe Zampaglione. I'm a task manager at the World Bank, and I'm managing a project providing meals in some 90 schools in Togo. And I had one question and one comment. One question is for Dan. Your study on Uganda is looking at this program that you actually assessed in I think, a very special context, which is a refugee camp. So the question is whether you think that some of the results that you got out of that assessment would change significantly if done in sort of a real world. I mean, the camps have some very peculiar characteristic. For example, you said about the calendar and the timing of the meal. Now, in camps, kids have the opportunity to go home or in their tent very easily and get some food there. In real life, the distance is such that that's not really an option that can be compared actually to what you have in a camp, and so on. I mean, there are a number of specific implications. For example, food availability in a camp is often something that is more important than in real life or in villages, in rural areas and remote areas. The comment that I had is about, I think, what also Harold referred to, this sort of move from comparing budgets for cost in school feeding programs to from comparing them to education budget to sort of social protection budget. And I think that that's a very welcome move, because we need to sort of move ahead from this concept of, you know, the educational impact of school feeding program and looking at it in a much broader context, which is their impact on poverty reduction and growth. As Dan was saying before, you know, this is, if you look from a long-term perspective, then you get a lot of the questions of sustainability kind of sorted out. But there's still a question that I think Harold very interesting sort of point out, that is that delivery mechanism. And the question I had is whether moving out also from the traditional delivery mechanism of meals or take-home ratios or other input from a centrally organized system where international agencies have a crucial role to play, to something much more autochthonous, much more local, with school canteens is going to be a solution to the cost issue.
As far as the issue on the Burkina Faso question, that study has an impact at the same level, somewhere 0.3, 0.4 on Z-scores, larger than I expected, but we looked at the children 1 to 3. They were not going to school, and it was take-home rations, another reason why it wasn't going to school. It implies food constraints in the household larger than I anticipated, but that is the result. Now, the flypaper effect, which has been actually another study done at IFPRI, showing that most of the food in the Philippines stays with the child. There's nothing, that study, nothing wrong methodologically with that study. I looked at it many times looking for the flaw. There isn't one. At least I can't find one. But it still would imply a type of household bargaining model where the child says, what's yours is mine and what's mine is mine. And I don't know how a child can institute that within a household, to say that everything additional given to me stays with me. It doesn't follow from household allocation. It's much more logical to expect a household will share. And I don't know why school feeding managers have worried about this sharing, because the younger siblings we know are more vulnerable to nutrition. In any case, the Burkina Faso result is quite in keeping, in order of magnitude, with the result from Uganda. Somebody mentioned about the external validity. I guess, again, thinking more of the Uganda in the camps, again, it's been shown in other contexts, like the Burkina Faso. It's very hard to design these types of study. If you want to randomize, you've got to find communities that are ready to start a program and are willing to randomize politically and keep the program randomized for a period of years. In designing this set of 3 studies, I visited 7 or 8 countries at the invitation of the World Food Program to discuss trying to design this. And in most cases, just couldn't set it up because of the timing issues and finding communities that serve as controls. So it is a question, and it would be very interesting to be able to expand this type of study to look at many of the issues that we've mentioned. But it is also just politically very difficult to do. One other point you mentioned about delivery mechanisms. There are a number of creative ways of trying to address this. Local procurement. Kenya right now is exploring giving cash grants to the school, allowing the school to decide how to purchase, what to purchase, highly decentralized. That's very promising, and Kenya believes they can bring the costs down to a third of what they have been in the past. There are questions. I've mentioned the issue. Would you get the micronutrients? I suspect you need to complement that with sprinkles or some other fortification package, which is quite possible. And also you'd have to consider, because when Lesotho decentralized in a similar manner, I am told, I have not seen the study, but I'm told costs actually went up. So again, it's the type of thing that is worth exploring, but worth keeping a good monitoring as well.
My colleagues have kindly given me the question on the donor trends in school feeding. It's a very good question. In terms of food aid, I think the trend is clearly downwards, and I don't know if there are colleagues from USDA or the European Union here who would want to comment on that in terms of policy, but a good deal of food aid, what was historically food aid production, is now going to, for example, ethanol production and other routes. On the other hand, as you all may well be well aware, the G8 summit allocated or committed $20 billion for food security. Food has become a really prominent issue in international discussion. Related to that is the issue that was raised about local procurement of food for school feeding. One of the key issues in trying to develop smallholder production of food is to provide stable and predictable demand for food. Smallholders, most of whom, of course, are women, smallholders can't just increase or decrease their production on demand. They need some predictable demand, and school feeding is one of the ways of achieving that. So it may be that the food security focus will also enhance the local procurement approach to school feeding. I would also mention there are new actors in school feeding. The Education for All Fast Track Initiative, a multi-donor initiative, the biggest development funder for education, is funding school feeding programs, not just TA, but actual programs in several countries. I think 5 countries I saw identified recently. And also that the GFRP, the Global Food Response Program, has been divided in. The World Bank has been divided into to create a rapid social response fund, which I think will be launched in the near future, which specifically includes school feeding as one of its areas of focus. So. I don't know what that says about the trend, and I think what we need to do is now track it and see realistically where the dollars are going. If I can just finish by the comment on the new delivery mechanisms, I want to point out that school-based financing of the kind that Harold was talking about, where money goes directly to schools which then spend the money themselves, has become one of the most prominent ways in which the education sector is now financing education. And we have an expert on that here, Philippe Barrere's book recently published on this topic. And that if money goes to schools and schools decide how to spend their money, this has huge benefits in terms of reducing leakage and ensuring that the money is very well targeted. If it's also used to support local school feeding programs, then it's also possible that those finances could help the local economy. That's something that now needs to be looked at and proven. But as you say, both Kenya and Ghana are experimenting with programs of this type right now.
But I wanted to speak to Giuseppe's question, which is a good one, about the generalizability of the Uganda results, since we were working in IDP camps, and I didn't have time to address it in the presentation. And I think there's actually pretty good generalizability for some of those results. Probably, maybe the spillover results to younger children, maybe that's a bit different than it would be elsewhere, except then we found it again in Burkina Faso through take-home rations. The school setting in those camps is very much as it is in other parts of Uganda, or at least in those areas before the displacement. There are larger schools for sure, and in some ways under more stress, larger classes and things like that. But the basic school structure is the same. So things like test scores and cognitive development, they were on World Food Program's typical school feeding program. So I don't know why those results should be dramatically different outside of the IDP camps. Attendance rates, even in the camps, are only about 75% pre-program. So even though the schools are close by, so there's other things going on: child illness, teacher absenteeism, school quality. Parents are responding to that. So the schools brought many of those kids into school. So I think there are still lessons there for other programs.
Alan Berg. Don, in his opening sentences, mentioned there were 3 constraints, 3 hurdles over the years in dealing with the nutrition community, among others, in trying to sell the importance of school feeding. I think there's a 4th, Don, and I think it's an important 4th, and that is the perception that school feeding is a nutrition intervention, and the implications and consequences thereof on national nutrition budgets. Be interested in your reaction.
Melissa Fraser from USDA's Foreign Ag Service. I wanted to ask, with the implementation of free primary education, as well as school feeding programs that have been going on, some education systems are overwhelmed by the number of students who are showing up now, and teachers are having 70 to 100 kids in their classroom, and it becomes more of a babysitting service. So I was wondering if there was consideration being taken for the effects of classroom size and teacher efficacy when additional classrooms might not be available and they can't manage the class size.
Great. There's actually a study on that, an IFPRI, and on the crowding effects, etc., in Bangladesh. if the success of school feeding, attracting kids into the school, is counterproductive for those kids who were already there. The answer is no, but the answer for that study was no.
Right, thank you, Alan. And I notice your skill with words has not at all diminished, and I don't actually recall saying that these were constraints on selling school feeding programs. I think the point I was making was that many of us, including myself, identified those three constraints as constraints, reasons for not being very favourably disposed towards school feeding programs. Let me put it that way. That in the nature of the debate, the expense issue, the exit strategy, and so on, were seen as constraints. And I think on our rethinking that perhaps the picture is less clear than it was then in that negative way. That there are clearly reasons now to explore this in more detail. On the issue of nutrition dollars, I think you and I would be in complete agreement with this. We would like to see school feeding as something that comes out of development dollars, and that there needs to be, I think this has been the trend in the whole discussion, that there needs to be a recognition. What is the objective of the school feeding program? What is it that's intended to be gained from that? Is it a safety net? Is it education? Is it nutrition? The evidence for social safety nets, the evidence for education seems to be very strong. There are some nutritional benefits. Are they worth the cost? But I think that's the way the picture should go forward. And I think there needs to be a rational debate about what we mean by nutrition when we talk about school feeding. Certainly with my nutrition colleagues, they wouldn't see school feeding as part of nutrition. But my non-nutrition colleagues certainly do see school feeding because it's food, as a nutrition intervention. I think clarifying those differences is really an important part of making a rational argument. But if you want me to be very specific on the nutrition issue, it's clear that nutrition needs to be earlier in life than at school age, and that your priority for your nutrition dollars is going to be minus 9 months to 2 years.
You mentioned that people who are not nutritionists say, well, because it's food, it must be nutrition. I'd say most nutritionists would say that food is really a small part of the entire nutrition intervention menu anyhow. So much of it is health systems and behavioral changes on breastfeeding. But I haven't seen the study. It's fully plausible that increases of school feeding programs crowd out nutrition budgets. But I haven't seen anybody who's actually been able to follow, because I don't know what does determine what a nutrition budget, how a country determines its nutrition budget, despite many studies trying to look upon the political economy of it. It'd be a great thing, all the researchers from IFPRI here, if somebody can figure out how nutrition budgets are determined and whether school feeding crowds it out.
Let me close with a few skeptical and enthusiastic remarks. On skeptics, I'm troubled by the economic analysis around school feeding programs. I think it's still driven from a fiscal cost and business cost argument rather than from an economy-wide costing. If a society feeds its children through the schools or through the parents in the households, doesn't make a difference if the cost is the same. And I think that very basic economic understanding needs to be at the background when getting obsessed about targeting. I think the targeting arguments around school feeding programs are driven by fiscal cost arguments and by business costing and not by economy-wide costing. Yeah? Harold, whether you feed your children or the Ministry of Education budget of the United States feeds your children and you pay your taxes, economy-wide doesn't make a difference. I think I'm not suggesting you don't give them their peanut butter sandwich anymore, and let it done through the school. But I think it's a serious deficiency of the economic analysis of school feeding programs, that it is not economic, but that it's fiscal costing. Secondly, on the nutrition effects, I think the two graphs which we have seen today hopefully have been shown for the last two times. Because I think the vertical axis, as our panelists have also said, does not make sense. Relating the education budget to the school feeding budget, makes as much sense as making the relationship between the defense budget and the school feeding budget. It's meaningless. I don't know how somebody could get excited about this graph. You showed it twice and then toppled the paper tiger over, which I think is good. But why put the paper tiger up in the first place? I think we need to have a serious look at the costing side, that's right, in a broad fiscal context. I'm echoing essentially what you have said, Harold. Third, I think, is my last skeptical remark. I think by putting up the window of opportunity, the under two urgent need to address nutrition problems on the one hand, versus the lack of anthropometry success of school-based interventions in nutrition, I think is also doesn't make sense. I think it has led to a self-isolation of nutrition community from the opportunity to form coalitions with human resource and human capital-oriented communities in the education, and has really not added value. I think we should all agree, as Don in the last statement said, we need probably both, and the new evidence which has been brought to the table by our panelists today about the apparently significant human capital effects in terms of human health and education and learning performance, I think adds to social welfare. So I think my appeal there would be there's a window of opportunity for broader coalition building in order to address the window of opportunity for nutrition interventions in early childhood. And I think that's happening. My two optimistic and enthusiastic comments are, number one, I think what you have opened up, Dan, on looking at sibling effects, seeing children as change agents in addition to their mothers or to the women or to the community, in carrying information, in carrying food, in carrying behavioral change capacity in communities, I think is a huge opportunity for research and action. I think anyone who has worked in slums or villages and hasn't recognized that the 2-year-old ones are carried around by the 6 to 10-year-old ones and not by their mothers, because the mothers have no time, will readily understand that there is a great opportunity for engaging children as change agents through the school system in order to deliver human resource improvements. I'm very optimistic about a policy meeting that was recently held by WFP in Bellagio, where several of us here in the room were, to take a fresh look at food for education, school-based institutional human capital improvement programs, including nutrition improvement programs through the effects which we have heard today. I think this will not close the debate at all, what we have heard from our three panelists today. We will see you back at IFPRI when we have more research. Our colleagues have, I think, done a fabulous job and deserve your resounding applause.